Welcome to MD Conversation. It is our sincere hope that this program will enhance the discussions between you and your physician regarding your condition. This program is not meant to replace these discussions with your doctor, but simply to make them more meaningful. The material in this presentation is independently produced. The mention of any medical product or drug does not imply its endorsement. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendations. This module discusses conservative treatments for overactive bladder, or OAB. Other modules are available which discuss other aspects of OAB. Each module is relatively short. However, in total, there is quite a bit of material. It is recommended that you take your time viewing one module at a time, and try not to take in too much at once. You are welcome to view each presentation as many times as you like. Furthermore, you may pause the presentation or skip through parts of it using the player on your left, and you may view the slides in any order you wish. The term overactive bladder, or OAB, describes a group of bothersome bladder symptoms, which include frequent urination, nighttime urination, urgency to urinate, and leakage episodes or incontinence related to poor control of bladder urgency. Let's look at some of the treatment options available for overactive bladder. We can divide these treatments into three broad categories: conservative measures, including behavioral and physical therapy, medications, and surgery. Numerous behavioral modifications can be made which can have a significant positive effect on the degree and amount of bother of one's bladder symptoms. We will examine each of these in turn. While some are more specific to overactive bladder, and others to stress incontinence, they are all worth reviewing here, and all can help improve your bladder health. These treatments aim to improve one's awareness of bladder and pelvic floor function and improve coordination between the two. Behavioral and physical therapy are most successful when done with one-on-one instruction with a dedicated physiotherapist or nurse. It is now widely accepted that behavioral therapy centers on patient education, which is precisely why you are viewing this presentation right now. Education leads to an understanding of normal urinary tract function and can improve your ability to self-regulate those functions. Without proper education, other behavioral modifications and physical therapy will likely fall short of their potential. There are several conservative measures that can be taken to make a big impact on OAB symptoms. These include fluid and dietary modifications, timed avoiding and proper bladder habits, smoking cessation, and weight loss. As a general rule, fluid restriction is not advisable as a means of dealing with OAB and incontinence. Limiting fluids will make the urine more concentrated, which can actually cause bladder irritation and worsen urinary urgency. It has also been shown to increase the risk of bladder infections. It is best to try to cycle a larger volume of more dilute urine through the bladder. The recommendation is to take in at least 6 to 8 cups of fluid, mostly water, every day to keep well hydrated. Selective fluid restriction is appropriate in certain situations as indicated by your physician. For example, someone who is taking in excessive fluids should be encouraged to cut back, and someone who suffers mostly from nighttime urination might be advised to cut back on fluids in the evening. Some patients are mostly bothered by frequent nighttime urination and do not have typical full symptoms of overactive bladder. If this is the case, consider these measures. Try reducing evening fluids, completely reducing fluid intake after 7 p.m. It is important, of course, to still keep your fluid intake up during the rest of the day. Be sure to empty your bladder completely before going to bed. Finally, when swelling of the ankles or feet occurs during the day, nighttime urination may result. This happens because when you lie down at night, the fluid is no longer held down in your extremities by gravity and is allowed to get back into the circulation. The body then has to clear out all this excess fluid and starts making more urine. To help manage this problem, if it is comfortable, try spending some time during the day with your head down and feet up on pillows above the level of your heart. This will help get rid of more fluid in the daytime when it's more convenient for you. Beyond this, you should see your physician as medications or adjustments to your medications may be required. Certain compounds may trigger nerves in the lining of the bladder, worsening OAB symptoms. These are known as bladder irritants. Caffeine by far is the biggest culprit, and it has been shown that reducing caffeine can improve the symptoms of OAB. This may be true for other foods, however it varies among individuals. Suspected irritants include sweeteners such as aspartame, spicy foods, acidic foods, and tomato-based foods. Eliminating these items one at a time from your diet is the only way to know how much they may be contributing. Finally, alcohol most definitely can worsen OAB symptoms as it directly increases urine production. If you have not already heard of enough reasons to stop smoking, you may be surprised to hear that cigarette smoking has harmful effects on the bladder. Smokers are 2.5 times more likely to experience urinary incontinence than non-smokers, and all types of incontinence are increased. This occurs for many reasons. Products of cigarette smoke may directly cause overactive bladder, and they are certainly irritating to nerve cells in the lining of the bladder. Furthermore, smoking weakens the pelvic floor both directly by reducing blood flow there and indirectly by causing chronic coughing, which stretches and weakens these supports. Most importantly, smoking is the single most important risk factor for bladder cancer. Obesity has many effects on the bladder as well. It increases the risk of stress incontinence mostly, but also mixed incontinence and bladder infections. Increased downward pressure on the bladder likely leads to more stress incontinence and OAB symptoms, while poor hygiene in obese women may result in bladder infections. Poor bowel habits are often overlooked as a possible cause of bladder problems and incontinence. Chronic constipation and straining to pass stools weakens the pelvic floor and leads to stress incontinence and prolapse of the vagina, both of which may be associated with overactive bladder. Regardless of what bladder problem you may experience, it is recommended that steps be taken to improve your bowel habits. These include increasing fluid intake, increasing fiber intake, and regulating one's bowel habits. Your family physician or a dedicated nurse or therapist can assist you with such a program. Certain hygienic and sexual practices for women may help to reduce bladder infections. While they do not directly impact on overactive bladder, they are worth discussing here, as bladder infections can certainly aggravate OAB symptoms. After urinating, wiping from front to back avoids bringing organisms from around the anus up to the opening of the urinary tract. It is common teaching that women should empty their bladder before and after sexual intercourse, and while it is not clear how successful this is in preventing bladder infections, it remains widely recommended. Water-based lubricants may also help to prevent against infection. Finally, avoiding the use of diaphragms, cervical caps, spermicides, which are found in some condoms, and some vaginal douches is certainly a wise idea. Other measures which can lead to improved bladder health include a regular exercise program, controlling a chronic cough, and regular visits to your physician. Regular exercise improves one's overall health and sense of well-being. It also promotes proper hydration, which can improve bladder symptoms. It promotes good blood flow to the bladder and pelvic floor, and it improves overall muscle strength and endurance. Chronic cough, such as with smoking, asthma, or acid reflux, also causes chronically increased pressures in the pelvis, which both weakens the pelvic floor and leads to more leakage episodes. These conditions need to be addressed with the help of your physician. Finally, regular visits to your physician can help to monitor these and other important health-related issues, such as diabetes, neurological conditions, menopause, and mobility problems. There are many different toileting programs. Some of these are independent, while others are assisted by a caregiver. The two most common toileting programs are scheduled voiding and bladder training. Scheduled voiding simply involves urinating at regular set intervals by the clock to prevent the bladder from getting too full and reducing leakage episodes. The goal of bladder training, or retraining, is to gain a greater control over urgency, to accept larger amounts of urine, and to reduce urge-related accidents. To be successful, this therapy requires significant motivation and is best done with the assistance of a dedicated therapist and occasional voiding diaries to provide feedback. Initially, you are asked to adopt a regular schedule of urination. For example, set a goal of only urinating every hour or two by the clock. When an urge to urinate does come on, try to suppress this urge using the techniques on the next slide. Gradually, you will be able to lengthen the interval between urinations. Try these techniques to suppress urinary urges. Stop what you are doing and stay still. Squeeze the pelvic floor 5 or 6 times quickly, 2 to 3 seconds for each contraction. Keep the rest of your body relaxed. Focus on something else, such as counting backwards. Finally, as the urge passes, try to walk to the bathroom at a normal, relaxed pace. This slide shows a typical voiding diary, filled out by someone with overactive bladder. Voiding diaries provide valuable information about the severity of your condition, as well as your dietary habits for you and your physician. This gives baseline information and allows your doctor to follow the effects of treatment. Diaries should be completed before or just after your initial assessment, a month or so after any treatment intervention, and periodically thereafter. It is best to evaluate 2 24-hour periods each time, one on a workday and one on a weekend or holiday. The second form of bladder training is pelvic muscle training. This works to strengthen the muscles of the pelvic floor, which support the structures in the pelvis, such as the bladder. The goals of pelvic muscle training are threefold: to strengthen the contraction of the muscle around the urethra and bladder neck, to regain the ability to unconsciously contract these muscles, for example, prior to a sudden unexpected sneeze, and to better activate these muscles voluntarily prior to straining or other increases in abdominal pressure. As an added benefit, the increased awareness of these muscles may lead to increased pleasure during sexual activity. This drawing shows the hammock-like layer of muscles called the pelvic floor, which supports the organs of the pelvis, namely the bladder and urethra, and prostate in a man, the vagina and uterus in a woman, and the rectum. When these muscles are weakened or damaged, the position and function of the organs can change. This close-up view of the bladder shows how the pelvic floor muscles are closely linked to the external sphincter, or valve muscle, which helps control urine flow. There are numerous described techniques of improving pelvic floor tone and strength, most of which have merit. The most commonly employed include Kegel exercises, biofeedback, devices such as weighted cones, and electrical stimulation. Pelvic muscle exercises are best done under the guidance of a dedicated therapist or nurse. Kegel exercises can be done anywhere, anytime, and require no assistance or props once you are doing them correctly. The keys to succeeding with Kegel exercises are to learn to identify the muscles properly and to stay motivated and perform them regularly. To identify your pelvic floor muscles, try squeezing around 2 fingers placed in the vagina, or imagine contracting the muscles that would stop your urine flow. It is important, however, to try not to perform these exercises during urination. This is just a method to help you understand the muscles involved. Another way to identify the pelvic floor muscles is to imagine the muscles you would need to use to fight off the urge to pass gas. If you have doubts about your ability to identify these muscles, it is best to consult your physician or another local expert, such as a dedicated incontinence nurse or pelvic physiotherapist. Otherwise, you may be wasting your time. It is an unfortunate fact that some women simply cannot identify these muscles properly. To begin Kegel exercises, first empty your bladder. When you begin doing the exercises, it is important to understand that there are 2 types of contractions to practice: short or quick contractions, and long or slow contractions. First, contract slowly for a count of 1, 2, 3, 4, 5, then relax for the same count. Now repeat this, but with quicker contractions to work the faster working muscle fibers. It is equally important to relax the muscle for the same time after each contraction. One set of exercises consists of 5 slow, followed by 5 quick contractions. Start by doing 10 sets, 3 to 5 times per day. Then increase until you can do up to 10 times per day. Start in a reclined position, then seated, and finally standing. Once you are underway, you should begin to notice improvements in 8 weeks or so. If not, revisit your therapist or physician. Kegel exercises should be done first lying down, then sitting, and finally standing as you become more comfortable with them. This slide suggests the appropriate positions. Remember, you must practice daily to make the exercise a habit. Make them part of another daily routine, like brushing your teeth, talking on the phone, or sitting in the car at a red light. You must continue to perform these exercises lifelong to maintain pelvic muscle strength and tone. Along with regular exercises, contract your pelvic muscles to control symptoms, to suppress a sudden urge to urinate, to keep it suppressed while walking to the bathroom, and to prevent leakage prior to a cough, sneeze, golf swing, etc. Biofeedback is a type of therapy usually performed by a dedicated pelvic physiotherapist or nurse. The goal of biofeedback is to enhance the effectiveness of pelvic muscle training. Biofeedback uses sensory signals to give us feedback as to the effectiveness of an attempted contraction or relaxation of muscles. These signals may be auditory, visual, verbal, or tactile. There are several situations where biofeedback may be of great use. To enhance pelvic muscle training for overactive bladder and urinary incontinence, to improve pelvic floor relaxation during urination, and for treatment of pelvic pain secondary to excessive muscle tension. Biofeedback also allows one to quantify muscle strength, which gives important information about where you are starting from and how your therapy is progressing. Typical methods of biofeedback include placing fingers in the vagina or rectum to gauge pressure, use of a probe in the vagina or rectum which is connected to a meter or electrical signal device called an EMG, and skin patches connected to a similar signaling device. Vaginal weights are another type of biofeedback tool. These cones are simply weights that are placed into the vagina. They are progressively shaped narrower and heavier so that the heaviest one is also the narrowest and thus the most difficult to retain. Patients place the heaviest cone they can retain by actively contracting their pelvic muscles in the vagina, and then attempt to retain it for at least 10 minutes. Once each weight is mastered, the next heaviest one is used. This needs to be done at least twice a day over a long period of time, just like bodybuilding, in order to be effective. These are obviously not for everyone, but they can be an effective method of pelvic muscle training that can be done at home with minimal supervision. Pelvic floor electrical stimulation is available at some centers. It can be a helpful assist to pelvic muscle exercises, but it does not replace them. This treatment involves the application of a low-grade electrical current to the pelvic muscles. This serves to stimulate muscle activity and further strengthen them, to inhibit bladder contractions and thereby reduce symptoms of OAB, and to improve pelvic floor relaxation. Pelvic floor electrical stimulation is usually taught by a dedicated clinician such as a doctor, nurse, nurse practitioner, or physiotherapist, and then is continued at home. As we conclude this module, it is important to remember that just as we need to learn to actively contract our pelvic muscles, we must also focus on relaxing those same muscles while urinating. Poor relaxation of the pelvic floor during urination can worsen OAB symptoms and can lead to retention of urine and bladder infections. Pelvic floor relaxation should be the first step to initiate urination. This relaxation must be maintained through the entire urination. To do this, take plenty of time, relax, and breathe slowly while urinating. Try not to strain if it can be avoided. This concludes our presentation. You are welcome to view this presentation as many times as necessary. When you are ready, we encourage you to access these other modules discussing overactive bladder. These resources may help you find further information or support about your condition. This is just a sample of modern references discussing overactive bladder, available at your local medical library. We hope that this program has given you a better understanding of conservative treatment options for overactive bladder. We wish you the best for the future, and thank you once again for using MD Conversation. Some bladder symptoms, which include frequent urination, nighttime urination, urgency to urinate, and leakage episodes or incontinence related to poor control of bladder urgency. Let's look at some of the treatment options available for overactive bladder. We can divide these treatments into three broad categories: conservative measures, including behavioral and physical therapy, medications, and surgery. Numerous behavioral modifications can be made which can have a significant positive effect on the degree and amount of bother of one's bladder symptoms. We will examine each of these in turn. While some are more specific to overactive bladder and others to stress incontinence, they are all worth reviewing here, and all can help improve your bladder health. Produced. The mention of any medical product or drug does not imply its endorsement. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendations. This module discusses conservative treatments for overactive bladder, or OAB. Other modules are available which discuss other aspects of OAB. Each module is relatively short. However, in total, Welcome to MD Conversation. It is our sincere hope that this program will enhance the discussions between you and your physician regarding your condition. This program is not meant to replace these discussions with your doctor, but simply to make them more meaningful. The material in this presentation is independent. There is quite a bit of material. It is recommended that you take your time viewing one module at a time, and try not to take in too much at once. You are welcome to view each presentation as many times as you like. Furthermore, you may pause the presentation or skip through parts of it using the player on your left, and you may view the slides in any order you wish. The term overactive bladder, or OAB, describes a group of bothersome